Smoking does not automatically mean that dental implants are impossible. However, it can increase the risk of healing problems and long-term complications, so it must be considered carefully during treatment planning. Smoking can affect blood flow, gum health, and the body's healing response. These factors may influence how the tissues heal after implant placement and how the area remains healthy over time. After placement, the implant needs a stable environment while the surrounding bone and soft tissues heal. Smoking may interfere with this process and can increase the risk of early complications. Over the long term, smoking is also associated with a greater risk of gum inflammation, bone loss around implants, peri-implant disease, and implant failure. But smoking is only one part of the assessment. The dentist must also consider gum health, bone condition, oral hygiene, medical history, the amount smoked, and the complexity of the proposed treatment. Patients may be advised to stop smoking before and after implant surgery and ideally for the long term. The recommended plan and timing should be discussed with the treating clinician and, when appropriate, a medical professional. You should also tell your dentist about vaping, nicotine products, and previous smoking habits. Honest information helps the clinical team assess risk and plan more safely. At Renova Clinic, implant suitability is assessed individually. Your smoking history, gum health, bone condition, and diagnostic imaging are reviewed before a treatment direction is discussed. Final suitability is confirmed only after clinical examination.